Welcome back to our Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Previously we discussed about pre-dentate and deciduous dentition periods. Today we will discuss mixed dentition, the period during which both the primary and permanent teeth are present in the mouth together is known as mixed dentition period. The permanent teeth erupting in place of previous deciduous teeth are the successional teeth, whereas those erupting posteriorly to the primary teeth are the accessional teeth, which include permanent molars. This phase begins at around 6 years with the eruption of first permanent molars and lasts till about 12 years of age. Now, the mixed dentition period again divided into three periods: first transitional period, intertransitional period, and second transitional period. So, coming to the first transitional period, so two events occur during the first transitional period. First is the emergence of first permanent molars, and second is exchange of deciduous incisor. Now, emergence of first permanent molar, the anterior-posterior relation between the two opposing first molars after eruption depends on the three things. First, their positions previously occupied within the jaws. Second, the sagittal relationship between the maxilla and mandible. The third is occlusal relationship, which is established by the cone and funnel mechanism, with the upper palatal cusp is cone, which is sliding into the lower occlusal fossa, which is funnel. The mandibular molars are the first to erupt at around 6 years of age. Their position and relation is depend on the relation of the second deciduous molars, as they are guided into the dental arch by the distal surface of this teeth. So, if the second deciduous molar is in flush terminal plane, then the erupting permanent molar will directly in the same relation, which is end-on-end relation. But there are 56% of the chances of class 1 relationship and 44% of the chances of class 2 relationship. So for these to change into the class 1 relation, means to change from end-on-end relation into the class 1 relation, the molar has to move 2 to 3 mm in forward direction. Now, how it will move? So this is accomplished by two things: early mesial shift and late mesial shift. The eruptive forces of the first permanent molars are strong enough to push the deciduous molars forward into the arch and utilizing the primate space. Now, what is the primate space? The space between the maxillary deciduous lateral incisor and the canine, and the space present between the mandibular deciduous canine and the first molar are called primate spaces, and the permanent molars utilize this space and thus establishing class 1 relationship. Many children lack primate spaces, many children have non-space dentition. So in these conditions, the molar establish class 1 relationship by drifting mesially and utilizing the leeway space. For now, you have to remember that the combined measured distal width of the permanent canine and premolar is less than that of the deciduous canine and molars. So there will be the extra space. Now this extra space is called leeway space of Nance, which is there in second transitional period. That's why the late mesial shift. Now if the second deciduous molar is in mesial step terminal plane, then the erupting permanent molar will directly erupt into the class 1 relationship. Further growth occurs, or if there is a more utilization of space, then there will be class 3 relationship. If the second deciduous molar is in distal step, then the erupting permanent molar will be erupt into the class 2 relation. If further growth occurs or there is more utilization of space, then it can lead into the end-on-end relationship. Now the second event is exchange of deciduous incisor with the permanent incisor. Now the deciduous incisor are replaced by the permanent incisor during this phase, and this period of transition is from 6.5 to 8.5 years. The permanent incisors are larger as compared to their primary counterparts. So there will be a requirement of more space for the alignment. Now this difference between the space available and space required is called the incisor liability. This is 7 mm for maxillary arch and 5 mm of mandibular arch. So the permanent incisor need 7 mm for maxillary arch and 5 mm for mandibular arch. There are some factors that help in the alignment of incisor by gaining the space. So first, there is the utilization of interdental spacing of primary incisors. We all know that there is a interdental spacing in the primary teeth, so which are average 4 mm in maxillary arch and 3 mm in mandibular arch. The second thing is increase in intercanine arch width. So this occurs as the child grows. Intercanine arch width is increased. It is 6 mm for maxilla and 4 mm for mandible, whereas in female it is 4.5 mm in maxilla and 4 mm in mandible. Increase in intercanine arch length. This is due to growth of jaws change in the interincisal angulation. So the angle between the maxillary and mandibular incisor is about 150 degree in primary dentition, which decrease in permanent dentition, which is 123 degree, so allowing more proclination and gaining space for incisor alignment. Coming to the intertransitional period, so in this period maxillary and mandibular arch consist of permanent incisors and permanent molars that sandwich the deciduous canines and molars. This phase lasts for 1.5 years and is relatively stable, no more changes. Only a few changes in the morphology of the deciduous teeth are seen because they undergo adhesion. Now coming to the second transitional period, this phase is characterized by replacement of deciduous molars and canines by premolars and permanent cuspids and the eruption of maxillary lateral incisor and canines. There are two events in the second transitional period also. First is replacement of deciduous molars and canines, and second is eruption of maxillary canines. These take place around 9 to 11 years of age and very critical for the alignment of the erupting permanent teeth. So the first replacement of the deciduous molars and canine. The combined mesiodistal width of the permanent canine and premolar is less than that of the deciduous canine and molar. This extra space is called leeway space of Nance and utilized by mandibular molars to establish class 1 relationship through the late mesial shift. We already gone through. The combined mesiodistal width of the canine and the premolar are less than of the deciduous canine and the molars. So it is 1.8 mm, in which 0.9 mm on each side in the maxillary arch and 3.4 mm, from which 1.7 mm on each side in mandibular arch. The dimension of deciduous second molar is more than that of the second premolar. So this excess space is called E space. Now E space is E minus 5. Coming to the eruption of maxillary canine. So the other event of significance in second transition period is eruption of the maxillary lateral incisor and canines. You notice this type of dentition in the child, this big space in the child. So let's see how it occurred and how it corrected. As the permanent maxillary canines erupt, they displaced the root of the maxillary lateral incisors mesially. This force is transmitted into the central incisor and their roots are also displaced mesially. Thus, the resultant force caused the distal divergence of the crown in an opposite direction, leading to the midline spacing, and this is called ugly duckling stage or broad bent phenomena. During the eruption of the canine, it pushes the root of the lateral incisor mesially. They push the root of the central incisor mesially. Due to that force, the crown of the central incisor diverged distally and there is a midline spacing which is called the ugly duckling spacing. This is a self-correcting malocclusion which is seen in 8 to 11 years of age or during the eruption of canines, was first described by H. Broadbent in 1937. This condition correct itself. How? Let's see. This condition correct itself after the canines have erupted. The canines after eruption apply pressure on the crown rounds of the incisor, thereby causing them to shift back to original position. No orthodontic treatment should be attempted at this stage, as there is a danger of deflecting the canine from its normal path of eruption. After the eruption of the canine, it is back in the position. In this part, we discuss mixed dentition period, which include the three transitional periods. In first transitional period, there is the emergence of the permanent molars and the exchange of deciduous incisor to the permanent incisor, in which we learn about early mesial shift and late mesial shift. Early mesial shift utilize the primate space, and late mesial shift utilize the leeway space. Then intertransitional period, no more changes in the intertransitional period, only the adhesion of the deciduous teeth, because they are gonna exfoliate. In second transitional period, we saw the replacement of the deciduous molars and canines and the eruption of the maxillary canines, in which we saw the leeway space and the E space. In next part, we discuss development of occlusion in permanent dentition and some self-correcting anomalies. Till then, these are the references. If you want this as a PDF or any other PDF, just like, subscribe and comment your mail ID with the topic, and I'll share you the PDF. New videos on Sunday. We also put nowadays an image based MCQs in pediatric dentistry in our shorts, and we will put lots of other type of MCQs related to pediatric dentistry. So press the bell icon for every update. Like, share and subscribe. Thank you.